pharmacist, but this year I chose to continue my education in learning here in the hospital. So I'm here for a year with the several different preceptors and pharmacists that are here working very closely with me and my 5 other co-residents in teaching us kind of the ways of the pharmacy in the hospital setting. I wanted to start out today's talk about drug interactions by asking everyone, what do you think a drug interaction is? If anyone wants to kind of volunteer and give their answer. When you hear drug interaction, what do you think? Yeah. Yeah, so it could be anything positive or negative from a drug. Yep, I saw another hand. You agree? Okay. Yeah, yep. So that is a very good answer. And we have some handouts here. So raise your hand if you don't have one yet. And Amy will gladly bring you one. Okay, so we were just double checking that it was the same version. So yeah, it looks like the slides are just a little bit different sizes on the 2 different versions, but they should be the same information. So getting back to the presentation, so what is a drug interaction? We've defined it as kind of any situation in which the effectiveness of a medication is affected by anything else. And that can really be several different things. Some of the more common ones are supplements, another medication, which is listed on the bottom there, a food or beverage, and also other health conditions. So it's more than just drug interactions. So we'll kind of go into each of those and talk about them individually. Supplements are products that contain what is deemed to be a dietary ingredient. I know that's kind of a vague term, and well, what does that really mean? So what the Food and Drug Administration is a federal program that regulates all food and medications here in the United States. And anything that doesn't fall under the medication category is deemed to be under the food category. And in that category, it's actually subdivided into the foods we typically think of that we eat during a typical meal, and then also the dietary ingredients, or anything that might supplement a regular meal. So anything in addition to our regular food. So some examples of that would be vitamins or minerals, which, as you know, you can buy over the counter. Amino acids, which are the basic building blocks of protein in our diet. So you'll oftentimes find these in any protein supplements or shakes and stuff like that you can buy over the counter as well. And finally, herbs or botanical products. Going specifically into some of these, some of the more common ones that can interact with drugs are listed here. St. John's wort, has anyone heard of that product? Yeah, that's a pretty common one out there. And this one actually can interact with quite a few different drugs, and it kind of depends on what that drug is, what that effect is. Sometimes it increases the levels of that medication, and sometimes it decreases the levels. So it's really important to kind of look at the medication itself and what that interaction is to know what it could cause, what kind of side effects or things of that that it might cause. Vitamin E is another one that is quite common in the grocery stores or pharmacies that people tend to take. This one can actually decrease the absorption of some medications when they're taken together, and it can also increase the bleeding risk. So if you're taking other medications that can increase the bleeding risk, that can also become even more of a problem. So just something, again, to be kind of aware of. The next 2, ginseng and ginkgo, are kind of similar to the St. John's wort that I had mentioned in that they kind of vary with how they affect other medications. Some can increase and some can decrease their levels in our bloodstream. Specifically, the ginseng, however, can also increase the bleeding risk. when combined with other medications. And the ginkgo actually specifically with medications called anticonvulsants. So people who have seizures may take these medications. The ginkgo can actually increase the metabolism or the excretion of those medications. So what that means is there'll be lower blood levels in patients who take these medications, and therefore they may have a higher risk of seizures because those blood levels aren't as high as they intend to be. Next, we'll move on to some drug and food interactions. So the food and beverages we eat on a daily basis can kind of do one of three things. They can either delay, decrease, or increase the absorption of our medications. And how that affects that is that it changes how quickly and for how long our medications are working in our body. So if we're not taking them as we're told, so either with or without food, it can either cause that to be too high or too much of that medication, or it can cause it to not be absorbed as well, and therefore we wouldn't have as much of that medication as were intended. Some of the common products that are seen out there that can interact with food, the first one being grapefruit juice. Has anyone kind of heard of this grapefruit juice? You can't be on it. Yeah, so grapefruit and the juices actually contain a product called, I want to make sure I say this correctly, furanocoumarins. It's a class of compounds that actually can inhibit or prevent the metabolism of some medications. So again, kind of increasing their levels, and oftentimes when we have higher levels of medications, we'll have increased side effects from those medications. Some people may say, oh, well, what if I just don't have grapefruit juice at the same time as my medications? Well, that in theory kind of sounds like a good idea, right? Unfortunately, these furanocoumarins that I talked about tend to stay around in our body for quite a long time, sometimes up to 3 days. So actually separating them from those medications really won't make a difference, and they can still have that interaction. So it's important to note that if your doctor or your pharmacist tell you not to take this medication with grapefruit or grapefruit juice, that you really do avoid that completely. Next one listed is green leafy vegetables. Has anyone heard of a medication called Coumadin or warfarin? Yeah. Have you heard that you can't have any green leafy vegetables while on that medication? Yeah, some people have been told that, and there is a significant interaction. However, it's not that you have to completely avoid it. It's really all about consistency when taking these two things together. The green leafy vegetables actually contain vitamin K, which actually reverses the effects of that medication, that warfarin. So it's actually what we would give you if you have too high of levels of warfarin in your blood to get that back to a normal level. So as I said, it's also in several green leafy vegetables. But if you really enjoy having those salads every day at lunch, that's really not a problem, as long as you keep that consistent and keeping that intake of the green leafy vegetables and vitamin K in general in your diet. You want to keep that the same. We can easily adjust the dose of that medication to kind of balance out that vitamin K that you're getting in your food. So while this is a significant drug interaction, it's one we can easily manage. Next, I have listed dairy products. So as we know, most dairy products contain calcium. And calcium, as I'll discuss in a later slide when we get into some more specific examples, can interact and bind to several medications, which then decreases the absorption. So you're really kind of just taking it and it's kind of going right through you rather than getting absorbed and doing what it's supposed to do. And lastly, we have listed alcohol. Now, I'm not telling you can't drink alcohol at all. It's just something you need to be aware of. Specifically with one medication, though, you do want to absolutely avoid all alcohol. It's an antibiotic called Flagyl or metronidazole. And when it's taken with alcohol, it can cause very, very severe nausea and vomiting, and that would not be fun for anyone. You, as soon as you would have that reaction, you would certainly learn pretty darn quick that that's not a very fun combination. So that is something that the pharmacist will be sure to tell you if you were to ever get this medication. Flagyl, so it's an antibiotic. It's not one of the kind of first line antibiotics used, but if you have kind of a different bacteria that isn't susceptible to some of the other ones that are more commonly used, it can be used to treat infections. So we will be getting into a couple more examples. So yes, you asked about what specific medications, and unfortunately, oftentimes this is antibiotics. So again, this isn't, we don't want you to completely avoid all dairy products or calcium products. I'll talk about this again when we get to that specific example, but in this situation, it's just important to separate them by at least 2 hours to avoid that binding in your stomach. Yes. So St. John's wort and Flomax. I would have to double check on that, but I know St. John's wort is used for several different indications. So again, it's kind of a risk benefit as far as the interactions go. So it, and I could definitely get back to you on that. I don't have that prepared, but feel free to find me at the end of the presentation, and I can definitely get your email address and get back to that. So as Amy was kind of mentioning, there's so many drug interactions out there. We have shelves upon shelves upon shelves of medications upstairs, and in this just short little hour time frame, there's no way I could go over every single interaction. So the purpose of this is to kind of make you aware of some of the main types of drug interactions, so that you can be more educated and be more aware, and so that you can be prepared to ask those questions and like Amy said, be your own advocate. Saw you had a question. Yeah, so teas, specifically the caffeine in a lot of teas and sodas and products like that, there can be interactions with the caffeine as well. Again, there's a whole list of interactions that could potentially interact, and don't necessarily have time to get into all of those. But if you have a specific question, I'd be more than happy to get your information later on, and I can address that with you. So kind of going back to the alcohol point, sorry we got a little away from it here, but the kind of other big interaction here is with other medications that can cause sleepiness or drowsiness, also known as sedation. So oftentimes this comes with pain medications or anxiety medications, or obviously medications that help us sleep at night. So when they're combined with alcohol, that sedation effect or sleepiness effect can become even greater than when either one is used alone. So it's just kind of something to be aware of, especially if you need to be driving or anything like that when using these medications. The other part of the drug-food interactions I kind of alluded to earlier is taking your medications with or without food, and kind of what does that mean? When we talk about taking a medication on an empty stomach, typically this means to take the medication at least an hour before or 2 hours after eating your meal. And why do we do this? It's because the food actually decreases the absorption of these medications. So again, kind of going back to the levels in our blood won't be as high as they are intended to be. On the flip side, when we tell you to take a medication with food, this is typically during or immediately following the meal, so your stomach is full and ready to digest. And why do we do that? That's because the food is either, the absorption of that medication is better when there is food present, or that medication can kind of upset the stomach, so it's really helping to make it more tolerable if food specifically doesn't change the absorption of that medication. Other drugs may specify a certain type of food to take it with. Kind of the most common one is they tell you to take it with a high-fat meal. Again, this goes back to absorption. That medication will be better absorbed when there is high-fat foods in your stomach. Moving on to drug disease or health condition interactions. Some of the more common ones I have listed here. So the top two are chronic kidney disease and chronic liver disease. So the kidneys and the liver in our bodies are the two main organs that actually metabolize or break down medications and toxins in our body. So if our kidneys and liver aren't quite working as well as normal, obviously that medication can kind of build up over time and get to dangerous levels. Thankfully, on most medications, we know how these medications are metabolized and can appropriately decrease that dose, so we can avoid that interaction. The next one I have listed here is diabetes. Specifically in this situation, we look towards medications called steroids. So oftentimes used when you're not quite feeling yourself, kind of have a little cold or an infection, can kind of help suppress the immune system and help get rid of that infection. But these medications, however, can increase blood sugars. And as we know in diabetes, the blood sugars are already elevated. So combining those two can be dangerous, but as long as we're appropriately monitoring our blood sugars and treating those blood sugars, this interaction is okay in most cases. High blood pressure is another one. Amy kind of mentioned it earlier with the Sudafed. Sudafed is oftentimes used kind of when you have a head cold, don't quite feel yourself again, and kind of used for that decongestant effect in your head. However, that particular medication can also increase blood pressure. So when we have already high blood pressure, and increasing blood pressure further can cause damage to our other organs over time. So if you happen to have high blood pressure and are kind of feeling under the weather, it's important just to talk to the pharmacist, because there are other medications out there that will do the same thing and would be a safer choice in that situation. And lastly, we have listed Parkinson's disease. Is anybody familiar with this disease and kind of some of the signs and symptoms? Oftentimes it's a little bit of shakiness and change in kind of walking patterns. And in this particular disease state, there is an interaction with a medication called Haldol. Oftentimes it's used for people who are having hallucinations aren't quite centered to who they are, where they are, and kind of the time and place. Unfortunately, though, in Parkinson's, some of the medications they use to treat their symptoms can also cause kind of these hallucinations or patients not quite understanding where they are. So unfortunately, sometimes Haldol is often used to kind of treat some of those side effects, but really it's actually quite dangerous in these patients. So we always encourage our patients with Parkinson's to make sure that they let their healthcare providers know that Haldol is not a good choice in them. And sometimes we will recommend that they list it as an allergy, but just based on some of the medications they have and the interactions that are possible. So on this slide, I have listed kind of the main categories of types of drug-drug interactions. And in the next few slides, we'll go into some specific examples of each. So first, we have the situation where one drug increases the toxicity. So when we say toxicity, that means high levels that are causing side effects that we don't want. The one drug is increasing the toxicity of another. An example of this is Bactrim, which is a common antibiotic. It's called a sulfa antibiotic, and Coumadin or warfarin, like we had talked about earlier. When someone takes the Bactrim in this situation, it actually increases the concentration of warfarin in the blood, which when we have too much warfarin in our blood, it raises the INR, which is how we measure the levels of warfarin. And when we have a high INR, it actually increases the risk of bleeding. So if someone who had a high INR maybe bumped their leg on the table or something as they're walking by in the living room, they'll bruise much more easily. And if they get a paper cut, it'll take quite a bit longer for that to stop bleeding than someone who would have what we call a normal INR level. Another example in this situation is Viagra, which is used for erectile dysfunction, and nitrostat, which is used under the tongue for cardiac or heart chest pain. And when these are used together, they increase a level of a protein in our body called cGMP, which lowers our blood pressure. And when the Viagra is on board, it actually prevents the removal of that protein in our body, which potentiates kind of the whole cycle, and the blood pressure will continue to decrease to very dangerous levels. So this is an absolute interaction that we do not want to happen. So if you are ever on nitrostat, you want to make sure you don't ever get any medications like Viagra. So kind of on the flip side of that, the toxicity, we have where one drug increases the effectiveness of another. Probenecid is a medication that, when given with other antibiotics, actually increases the level of those antibiotics, which is actually a good thing if we have a very difficult or very serious infection. We don't have to give as much and cause less maybe upset stomach or something like that with the antibiotics, but we're still getting those higher blood levels to help treat that infection. That cause what? I'm sorry? And when you say potentiation, what do you mean by that? Increasing the effects? So that's what we're talking about here. So so pro so the next one here. So when we give gentamicin, which is another antibiotic, and ampicillin, which is a different type of antibiotic, they work together actually better than they would if they were given individually. So it's kind of the idea where 1 plus 1 equals 2, but in this situation, 1 plus 1 might equal 3. So they work actually better when given together. Again, that'll depend on what those medications are. So in an antibiotic situation, it might not necessarily cause an interaction, but say it was with a pain medication and something to help them sleep at night, and then they decide to have a couple drinks before they go to bed, they may have some trouble waking up, or their breathing rate might slow down to almost dangerous levels. Mm-hmm. Looking at the next one here, we have where one drug decreases the effectiveness of another. So in this situation, this was kind of what I was alluding to earlier with the calcium, where multivitamins, so any products that might contain calcium, magnesium, iron, and things like that, so whether or not they're all combined in one tablet as a multivitamin or individually, and combining them with antibiotics. So specifically, Levaquin is kind of a big factor here. When they're taken together at the same time, they actually bind together in the stomach. So then that Levaquin, the antibiotic, won't be absorbed, and you won't be treating that infection as well. So in this situation, we want to make sure you separate those products by at least 2 hours from each other. And this, again, like we talked about in the dairy products, kind of ties into this and separating it by 2 hours. Another one you might have heard about in the news in the past few years is Plavix or clopidogrel, which is used to kind of thin the blood and prevent blood clots, and Prilosec, which is often used for heartburn or acid reflux. There have been a few studies that show that the Prilosec may actually decrease the effectiveness of the Plavix, but it's still a little bit debated on whether or not this is a true interaction. So kind of be aware of this, and if you get a prescription for Plavix, it will say this in the paperwork that they give you, but know that they're still doing research on this interaction and trying to determine if it is a true interaction or if it's related to something else in these previous studies. And then lastly, we have the situation where 2 drugs are taken together and they end up kind of just canceling out the effects of each other. Indirel or propranolol is a medication used to either lower heart rate or lower blood pressure, and Ventolin tablets, also known as albuterol. When these two are taken together, the Indirol or propranolol actually blocks the effects at what are called beta blockers, which are on several types of different cells throughout our body. And the Ventolin actually stimulates them. So when they're taken together, they kind of cancel out the effects of each other. Another example of this is Entereg, alvimopan, that's a tricky one to say, and opioid pain medications. So examples of that could be oxycodone, hydrocodone, things of that nature. Again, these work on mu receptors, which again are kind of all over our body, and when taken together, one will stimulate and one will block these receptors. So again, they will kind of cancel out each other. Propranolol. Yep. That is a great question because there are several medications that sound very similar but don't necessarily work in the same way. So that is a great point that you bring up. If you're ever confused, don't feel scared or hesitate to ask to have someone clarify that for you. Okay. So then the last one we have here is where 2 drugs work together to increase their effects. So oftentimes this is seen in combination products. So in blood pressure, instead of having to take 2 tablets, a lot of times they're combined. So instead of having 2, you only have to take 1 tablet at a time. So a common example of this might be a lisinopril hydrochlorothiazide tablet. Again, another example of this might be inhalers. A lot of times, the inhalers that you take every day have more than one medication in there, and they're working in different ways, but working together to help you breathe better. And again, pain medications. A lot of times, they'll have an opioid as well as Tylenol in them. So not only will they work together, but it's also important to know if your medication has Tylenol in it, so that you're not taking additional Tylenol as well. So here I kind of have an example. Let's say you, over Christmas, go back home to Ohio, and on your way home, you kind of get a head cold. And so you walk into the pharmacy and think, okay, yeah, I kind of have a cold, and maybe this multi-symptom relief product will help. And I'm also kind of having trouble sleeping at night, so this ZZ-Quil might help me sleep better at night. And I kind of just have some aches and pains all over, so I think I should grab some Tylenol. Does anyone think there might be a problem with taking these products together? Yeah, so the top one here is the ZZ-Quil, and the active ingredient in this product is called diphenhydramine, also known as Benadryl. And the second one I have listed here is that kind of multi-cold symptom product. It also contains that diphenhydramine or Benadryl. And that same product actually also contains acetaminophen, which is the generic name for Tylenol, which is listed here on the bottom. So if you are taking all three of these products together, you're actually getting double the amount of both of these medications than is typically recommended. So kind of the take-home point from this example is if you're accidentally taking too much of a medication, even if you don't know it, those side effects can increase. In diphenhydramine, oftentimes that makes people very sleepy and sedated. So you might have trouble waking up when you thought you would be able to wake up. And with Tylenol, over time, if we take too much of that, that can really cause problems with our liver. And that's where that is metabolized. So it can cause liver issues. So it's always important to be looking at the active ingredients in all over-the-counter medications that we are using. And I know oftentimes they're very small print and kind of confusing. So if you're ever confused or unsure, please ask your pharmacist if they're safe to take with not only each other, but also your prescription medications. A pharmacist has resources available to them to be able to check for drug interactions. So if you're unsure or just want someone to double check, they have that resource available to them. So please feel free to always ask them. So next I wanted to move into kind of some ways that you can help to avoid these drug interactions. I have them listed here, and we'll go into each of them in a little more detail on the following slides. So the first one is always know what medications you take. So everyone got one of these handouts, right? So this is just one example of a medication list. Some people prefer to do it on paper. Some people, if you're really tech savvy, you can also do it on your cell phone. And I know the ladies here in HealthConnection have several different apps that they can help you set up on your phone, and would be more than happy to help and sit down with you and do it that way if you prefer. So getting back to the slide here, we always want to encourage everyone to carry an up-to-date medication list with them at all times. Unfortunately, we never really know what's going to happen. And on this list, we want you to include not only the medication name, but also the dose, how frequent you take it, and why you're taking it, as well as the prescriber. So if for some reason you get in a bad car accident and you get knocked unconscious, we would have that information available to us, and we would know who to call if we had any questions. Also on this list, we encourage you to include any over-the-counter products, herbal products, or vitamins, as well as any allergies you might have. So again, if something unfortunate were to happen, whoever is helping to take care of you would know all of that information. To tie along with that, we always encourage everyone to communicate their medication lists with their physicians. I know it's not very common that you only have one physician prescribing all of your medications. So it can get kind of confusing to keep track of who's prescribing what and for them to kind of keep track of what other medications you might be on. So since you already have this handy dandy prescription list on you at all times, you might as well just pull it out and share it with each physician that you see at each and every visit. Anytime there's a change, they want to know, so you'll have it handy and right there to share with them. We also encourage everyone to utilize only one pharmacy. Every time a prescription is filled, they're actually checking for any possible drug interactions that might happen with your medications. But unfortunately, if you decide to use, let's say, Walgreens a couple blocks from work, but then a couple days later you fill a different prescription at Publix a couple blocks from home, their two systems don't talk to each other, so they can't know what you filled a couple days ago at the other one. So we would always encourage you to utilize one pharmacy, and I know sometimes that can be difficult, so at least trying to stick within one chain, because their systems are able to communicate with each other. Next, I always encourage everyone to review the paper handouts that come with each prescription. What this is kind of a shortened and condensed version of what they call the prescribing information. So all the information the physicians have available to them to help decide on the best medication, the best dose, and things like that for each and every patient. So in this handout, it'll include information about any potential interactions, if you should take it with or without food, and any other health conditions that might be a problem if taking this medication. And lastly, we want you to review any over-the-counter herbal or vitamin products with both your physician and the pharmacist. Again, we want to try and avoid as many drug interactions as possible and want to make sure your medications are safe for you to be using. Like I mentioned earlier, a pharmacist has the resources available to run a drug interaction check. Even if it's, say you stopped at Target to pick something up, but you don't fill your prescriptions there, if you have that list with you, they'll be able to run that check. They don't have to necessarily fill stuff at their store in order to be able to run that interaction check. Like we talked about in the example, many of the over-the-counter products have multiple ingredients in them, and it can be pretty easy to kind of accidentally double up on something. And a pharmacist can very quickly look through that and make sure that there aren't any accidental duplications there for you. So, kind of the take-home point of this presentation, we encourage you to be asking questions. You're going to be the best advocate for yourself in preventing these drug interactions. I have listed here some good starting points and questions to ask both your physician and the pharmacist, including, can I take this with my other medications? Is there anything else I need to avoid while taking this medication? Are there any possible drug interactions that I should be aware of? And how does this medication work in my body? As well as any other question you might come up with. Asking too many questions is never a bad thing. It's always a good thing to be more informed and be well informed about your health and your medications. In summary, this is just a brief list. As I mentioned, there are thousands and thousands of medications out there and so many possible different interactions. So unfortunately, in this short time we have together, we can't review each and every interaction. But this is a list of some of the more common medications or medication classes that do have drug interactions. As we talked about warfarin, amiodarone is a medication to help control the heart rhythm. Acid reducers, so we talked about Prilosec or omeprazole. There are several others in that class. One specific I wanted to mention is a Tagamet, is a medication that used to be over the counter and still might be available in some stores. But this one can, unfortunately, cause quite a few different drug interactions. So if at all possible, it's really important to avoid this medication. Antihistamines, so anything for allergies. Again, just double checking that it's still safe for you to use. Asthma medications, laxatives, as we mentioned, decongestants, sleep aids, and pain relievers. Statins, has everyone heard of those used for cholesterol? Yeah, those unfortunately can be a little bit of a bugger when it comes to drug interactions. Um, we talked about a couple different antibiotics already. I wanted to highlight a couple different classes specifically. Macrolides is one class. Some medications in that class include erythromycin or chlorothromycin. And then fluoroquinolones is kind of the other big culprit in the antibiotic class. Medications in this class include Levaquin or Cipro, as well as Avelox, which isn't typically seen as often, but can still also cause several drug interactions. Antifungals, blood pressure medications, and anti-seizure medications are also classes that can cause several different drug interactions. So great question. She asked about pain relievers, specifically anti-inflammatories that can be used for arthritis. And unfortunately, yes, those can also cause drug interactions. So again, it's just asking those questions and making sure they are safe. So her question was in relation to those medications, specifically the NSAIDs or the anti-inflammatory medications, and whether or not they can raise blood pressure. Um, Typically, I haven't seen that they raise blood pressure. However, the biggest risk with those medications is the risk or the increase in bleeding risk. Those they work in a little bit different way than some of the other medications that increase the bleeding risk, but when combined can kind of make that risk even higher. Yes. Yes, yes. Chemotherapy medications are that is a great question. And unfortunately in that situation, um, it kind of does come down to a guessing game. Oftentimes, when medications aren't as critical as chemotherapy, we tend to recommend that you only start one at a time, so that if you would have a kind of an adverse reaction or something to a medication, that you know that that's what it's from, rather than starting, say, 5 brand new medications at a time and you kind of have this new leg pain. Well, how can you determine which one that's from? Unfortunately, in that situation, you can't necessarily. So yes, in those situations where you do have several chemotherapy agents starting at the same time, it can be difficult to kind of tease out which one might be that causing that. Mhm. Yeah, so in regards to the antihistamines, kind of for seasonal allergies and some of the more common medications like blood pressure medications, and again, without knowing exactly which medication we're talking about, I don't want to necessarily. Right, yes, so in Claritin, but without knowing kind of what other medications specifically, because one beta blocker may have an interaction with it while another one might not. So it's not necessarily a kind of a all blood pressure medications will interact. Um, I know, and unfortunately, it would make things a lot simpler if they were. But if we had a specific drug with a specific drug, we would be able to more accurately answer that question. So if you do have a specific question, feel free to grab me at the end, and I can definitely get back to you on that. And I just kind of showed a small portion of kind of all the information that's provided on over-the-counter products. So there will be um, sections for dosing and indication and um, what are called contraindications. So things you shouldn't be doing, disease states you have that you shouldn't take this with, or foods you shouldn't take this with. So there is plenty of information provided on the boxes of these products as well. Yes. Mm-hmm. Shape, color, yes. Anytime a new generic product is approved by the Food and Drug Administration or the FDA, the active ingredient is the exact same. Now, can I promise the inactive ingredients? So everything else that kind of makes the tablet? Maybe not. Maybe they don't necessarily regulate that. Right, unfortunately. Yeah. Yeah, I've had patients in the past who are very severely allergic to dyes, so they do have to have the plain white tablets, but for the majority of the population, a generic changing from one generic to another on most medications shouldn't be a problem. Hospice. Okay. Yep. We actually here have designated pharmacy staff that review that interview patients when they're admitted from the ER to make sure we have an accurate home medication list. And when patients come in with an accurate list, it makes their job so much easier, and we can get through more and more patients and make sure we have. Yeah. Yeah.
And we become investigators, detectives. That's our second role. Pharmacist first, detective second. And you have, let's say, you're coming in for surgery. Well, your surgeon is a great surgeon, but he does not know what your cardiac meds are, I guarantee you, or any of those other conditions are. And so he just says, Continue the meds like you're taking at home. Well, we're really relying on you to give us that correct information so we can get the correct order from him. And he's not going to know. So if you don't know, and he doesn't know, you may not get the right thing. That's why we include prescriber on here. Because if you tell us who your cardiologist is or who prescribed it, we will call that office directly and get the right information. So there are great apps. I know Jen mentioned it. In fact, I downloaded one to kind of test it out, and it is very helpful.
One example that they have iPads here that
Which one is this?
is this
Oh, that's the
CareZone?
one I like. Okay.
This is
That's the one.
CareZone. That everyone
my
who works
favorite.
here in the HealthConnection are
I can actually show that to you on my phone. It's called CareZone. Yes. What is very neat about this is I wish I had a prescription bottle to actually show you. But you take your prescription bottle, take your phone, and you hit the button to add a new medication. And then it says take a picture. So you take a picture. Then it says turn, take a picture. Turn, take a picture. Turn, take a picture. And then when you think you're done, you take as many as you want, you hit done. Now it starts to process that information, and you go to your next prescription bottle. Take a picture, and you just do that. Well, from that prescription label, it pulls all that information. It pulls the name of the pharmacy, the phone number, when you last had it refilled, the name of the drug, the strength, the directions, the physician, everything is automatically pulled. So you don't have to sit there on that app and type that in. It then also gives you an opportunity once it uploads. It says, please review to confirm that it copied everything correctly. So you do have a chance to look at it, confirm, confirm. And now I get alerts because it'll tell me last refilled, you're due for your next refill. But being able to take those pictures and having all that information upload, I thought was such a neat function. And then you can have it remind you or not. So if you want to be reminded when to take it, you could say, yes, remind me. It's twice a day. I take it breakfast and dinner, so remind me at 8 a.m. and 5 p.m. And that thing is still going off. I actually have to shut it because it was just a little trial, and it's still, I'm sure I have reminders on there right now. And it gives you three reminders, you know. First, second, and the third, it's a little pill bottle shaking noise. That's kind of like your last reminder. But there's so much technology out there that you can all take advantage of. But quite honestly, it doesn't even have to be that. This does the job as well. And it doesn't have to be this big. I actually like smaller, half size. It just makes it a little bit easier to, you know, fold, tri-fold, and keep it in your wallets and purses. But it does not. That would be nice. Yes, and Jen mentioned as well, you all have many specialists and physicians that you see, and they don't communicate. They're certainly not going to call each other to be your own advocate, and you need to let them know. So first, go with this accurate list to your physician's office visit.
keep it updated. Anytime there's a change, you want to
Cross
make
it
sure
out,
you change.
add whatever. And secondly, keep a little pad out. So when you know you have an appointment coming up and you think of something, write it down. Because I guarantee you when you go there and the doctor says, how are you? And you say fine, and you had 10 things you wanted to review with him or her, and then you walk out of that office, and just as you're walking out, I forgot to say 5 things. And then it takes you 3 months to get back in, and you forget. Okay? So keep a pad, jot down questions. If you didn't feel well, if you're having reactions that you think might be to something, if you're not sure that medicine's helping you, whatever. Keep track of those so you know what, when you go in there, you're ready for him or her. Doc, I have a few questions. So get your money's worth out of that visit. Where do you go? Yeah, it depends. I know some stores are definitely busier. So the very high volume stores, it does become more challenging. Yeah. Yeah. Another thing, little fact here, SMH has, I don't know, we probably have about 50 pharmacists that work here and about the same number of technicians. We have pharmacists in our ER 24 hours a day, 7 days a week. They go to all trauma rounds, all codes, all strokes, all kinds of emergent. They're there all the time, anyways, but they're actually at the bedside in certain types of situations. We have students, residents that help to be extenders of what we do. So when you come to the hospital and you're getting medications and you don't know what they are or you're having side effects, our pharmacists are very involved in the pain team. They'll see all patients that are getting the patient-controlled analgesias, any kind of consults to help with pain control issues and all kinds of other consults. So basically, you can always say, I would like to see the pharmacist because they're out on all the floors. So even if one doesn't actually seek you out because whatever conditions you have, you just didn't make their list, there's one walking down the hall right now. You can ask to see and speak to one if you would like.